Are you having knee pain or pain with bending your knee with everyday activities? Are you a runner that's having pain every time you go out to run? Are you unable to squat or lunge in the gym without knee discomfort? My name's Tyler McGachy from Warrior Sports Physical Therapy. Please stay tuned for a detailed video about your knee, some of the structures within your knee, and what things may be causing that pain or discomfort that you're having with everyday activities that's keeping you from what you love. The knee joint is a joint that connects your thigh to your lower leg. It is one of the largest joints in our body. It helps to support our body weight and supports our leg bending and straightening. These movements are vital when we walk, when we run, when we jump, and do a variety of other everyday activities that allow us to move freely without us even having to think about it. Our knee joint is also what's called a synovial joint. This means that the joint has fluid in it that allows our joint to be able to move freely and smoothly without getting caught up on certain things, and allows for extra cushioning between the joint so that it can again move freely with as little friction as possible. Functionally, our knee is what's called a hinge joint. This means that it moves within one plane of motion. Like I mentioned, the primary movement within our knee is bending and straightening. Although there is minimal rotation, the fact that it's a hinge joint means that most of the power and function that we get from our knee primarily comes just within that single plane of motion. Lastly, there are two articulations, meaning where bone meets bone within our knee. One is the tibiofemoral joint, meaning where the tibia, lower leg, meets our femur, our upper leg. And the second being the patellofemoral joint, meaning where our femur, again, the upper bone of the lower leg, and our patella, aka your kneecap, meet each other and rub up against each other to help perform certain movements and activities. We're now going to talk about some of the main supporting structures of your knee joint. The first being the major ligaments that are in your knee joint. So the first two that I'm going to discuss are going to be called the collateral ligaments. These are your MCL and your LCL. These ligaments are like straps on the inside and outside of your knee that help prevent your knee from moving side to side too much. The other two major ligaments in your knee are called your cruciate ligaments. These are your ACL and your PCL. These ligaments cross each other in an X-shaped structure within your knee joint that help to prevent your knee from moving forwards and backwards too much with functional activity. These ligaments are named for their attachment on your tibia or lower leg, meaning that your ACL attaches to the front part of your lower leg and your PCL originates from the back part of your lower leg, again crossing to attach on your femur and provide stability for your knee joint. The next major supporting structure of your knee that I want to talk about are the muscles surrounding your knee. So we have two major muscle groups that work to act at the knee, meaning that there are two muscle groups that create a majority of the movement at your knee. The first one are your knee extensors, or what work to straighten your knee. The second being your knee flexors, or the muscles that work to bend your knee. The major knee extensor group is your quadricep muscle groups. These are four different muscles that run down the front aspect of your thigh and attach on your quadriceps tendon to again work to fully straighten your knee as forcefully and powerfully as possible with running and jumping movements. The major knee flexor or knee bending muscle group is the hamstring muscle group. These are three long muscles that are strap-like that run on the posterior or backside aspect of your thigh, originating up by your hip and then attaching down behind your lower leg on your tibia that again work to bend your knee forcefully with functional movements. The next supporting structure that I want to discuss in your knee are the two major tendons that we find. The first major tendon is your quadriceps tendon. This connects your quad muscle group that I just discussed to your kneecap, which is also known as your patella. The second major ligament attaches your patella to your lower tibia, and this is called your patellar tendon. The last supporting structure for your knee I want to discuss is cartilage. There are two different types of cartilage that we can find in our knee. One being hyaline cartilage, which lines the joint and allows for fluid movement between the bones and surfaces. The second being fibrocartilage, which in our knee we know are the two meniscus, one on the inside, which is your medial meniscus, and one on the outside, which is your lateral meniscus. These structures are a little bit of a thicker type of cartilage that work to absorb force and keep structures in place with movements. Some of the most common injuries or pathologies that we see at the knee joint are osteoarthritis, bursitis, tendinitis or tendinopathies, ligament tears, including ACL, PCL, MCL, and LCL tears, with ACL and MCL being the most common, meniscus tears, both medial and lateral, fractures, dislocations, more commonly of the patellofemoral joint or your kneecap dislocating on your knee, and then patellofemoral pain syndrome, or pain that happens from the backside of your kneecap rubbing against some of the bony surfaces of your femur. A couple of do's and don'ts in order to maintain the health of your knee joint. One, we want to make sure that we maintain a proper diet and that we're regularly exercising to make sure that we maintain the strength of our knee joint. The second thing that I would recommend is to make sure that you're visiting a healthcare provider for regular checkups, and that as soon as you start to notice any changes within your knee, that you visit a healthcare provider immediately in order to discuss those symptoms. Lastly, you want to make sure that prior to physical activity, you're performing a proper warm-up utilizing the RAMP method, meaning raise body temperature and blood pressure and heart rate, activate specific muscle groups around your knee, mobilize specific muscles and tendons around your knee, and then potentiate or get nerves firing to the muscles around your knee so that your body is prepared for activity and you don't go in cold, so to say, and increase your risk of injury. A couple of don'ts when it comes to your knee. Do not continue to maintain your current activity level if you're experiencing consistent, frequent, and increasing pain levels within your knee. And do not ignore symptoms such as swelling, redness around your knee, painful clicking and popping in your knee, grinding, or warmth or a warm feeling to the touch of your knee joint. If you're having issues or continual pain with the joint that we discussed today, if you've tried fixing this on your own, or you've seen another healthcare provider and tried other treatments that just aren't working, feel free to take a look at our website and schedule an evaluation with us today so that we can take a deep look into what is causing your pain, figure out what the root cause of that is, and then get you on a plan and a road to recovery going forward. Again, this is Dr. Tyler McGachy from Warrior Sports Physical Therapy. Thanks for listening, and stay tuned for future content about other body joints and what may be causing aches and pains in those as well.